Yes.
Hey, excellent. So I'm hoping that everyone's in here that should be. But first of all, hello everyone. I hope you've taken something from the open day in the AGM so far, and thank you all so much for joining us on this very sunny Saturday afternoon. It's always harder to sit with tech when you could be in the garden in the sun, so we really, really do appreciate it. Um, I'm going to be giving you a bit of a talk today about access to education and the information that I'm going to give you and the challenges, but also the consultation is um, relevant across the board to primary school, early learning, primary school, secondary, college, and in terms of education plans, university as well. We're going to go through the challenges and the benefits of inclusive education, how you as a parent can support your child or your young adult in advocacy, but also what this new paper means, how you can impact the paper, and how Little Hearts Matter have impacted the paper up until now. Does that sound okay to you all? Hope so, because I can't hear anyone. So access to education, first of all, disclosures. Obviously, I am part representing Little Hearts Matter and you guys on these certain groups. So in the Health Conditions in Schools Alliance, which is the group that linked us so that we were able as an organisation to impact the new statutory requirement. The Cardiac Youth Working Group, I have written Cray instead of care. I apologise. Holistic Care Subgroup. So that's more work that we're doing within LHM. We're currently on a subgroup reviewing the holistic care process for heart and lung transplant, and PPIE for the chat tool that you just heard all about from Kerry. So let's get to the actual subject matter itself, because education is something, or access to education is probably the main challenge or topic that we get support requests for from you guys as parents. I every week talk to parents and teenagers about school, college, their level of understanding, what they can do to support aspirations within children and young people, and how to improve it, because everyone's end goal should be the same, in that the individual child, young person, or young adult is able to fulfill their individual potential and their aspirations, though they should be realistic, shouldn't be on the floor because of their condition. So in on our 25th anniversary, myself and Susie did a parent survey, and a big part of that parent survey was challenges in education, because this is not a new challenge. This is a challenge that we've supported people through over a long, long period of time. And within that survey, 62% of you, our parent members, expressed concern that the school staff didn't fully understand the condition. And if they didn't fully understand the condition, how were they going to implement the support that they needed? A lot of people, a lot of parents have expressed to us that the school thinks that after their surgery they're suddenly fine and they're cured, or that they would misinterpret fatigue as laziness, and they wouldn't understand how the fatigue might access their ability to concentrate or intake information. Going slightly off kilter is just the reminder that though every child and teenager that we support has a single ventricle heart condition, their need for support um, fluctuates, or is should be seen as a child by child basis. We have some children and young people that have had minimal struggles within school, and have gone through education up to university with very minimal support needed. But then we also have, on the other end of the spectrum, children that need quite heavy support. They might have additional learning deficits. They might be neurodivergent, as additional challenges. So, what I am saying to you, or what I am presenting to you, I'm going for the most support needed. So, please take from it what you need to as a parent. So we know that inclusive education can lead to a reduction in isolation, increased confidence and independence, increased aspiration, and increased emotional well-being. And those are four targets that every parent wants for their child. We know that the feeling of isolation can really impact mental health. We know that a lot of times confidence and the ability to be independent is a challenge that our children and young people face every day in most aspects of life. Not all of them, but a lot of them do. And feeling included and feeling like they're accessing and understanding this education can really build that confidence, which can then naturally segue to confidence in all other arenas that they might meet in their life. Inclusive education can increase aspiration. I will always go back to a survey that we did a few years ago where we asked the youth members what they wanted or what they could see for themselves in the future. And a 10-year-old or 11-year-old responded, well, I've been told at school that all I can really do is work in a cafe. But it should be a small calf because I probably don't even have the energy to work in a big calf. And that was information that had been imprinted on them. So their aspiration was at the very, very lowest level. So that inclusive education and the school and all the workers within school understanding the abilities of children with single ventricle hearts can increase that aspiration and increased emotional well-being. If you're feeling singled out, if you're feeling like you're failing, when it's going to really increase your emotional, or not decrease your emotional well-being, which again is going to have a huge knock-on effect in all aspects of your life. There are certain ways that we can try and get that inclusive education, advocacy for your child, leading by example as a parent. And I know it is a full job in itself. And I know working with certain schools can sometimes feel like you're banging your head against a wall or they just don't seem to get it. But we want to show our children how to advocate, and the best way that we can do is by doing that ourselves. Accessing the correct support tools. There are plans in place, or that should be in place. There are statutory guidelines that the school legally should be following. These are the tools that we can use to hold the educational provisions accountable. And a multi-agency approach. We hear that term often in social care and in hospital care, but it's across the board. Are the school and the hospital team working together? Do they even know each other exists? Like, they know that each other exists, but has there been any contact between the two? Are they supporting each other so that there's an umbrella understanding of what this child needs? If not, is this something that you as a parent can help put in place? So we're going to look at the barriers to inclusive education, and these are barriers that can sometimes feel like a never-ending wall that you can't climb over. But it is achievable to overcome these barriers. But let's talk about what they are. So a lack of awareness and understanding on the school's part, not on your part as a parent. So if they don't understand the heart condition at all, if they don't understand how the heart condition can impact their ability within their lesson time, but also in the playground, how are they going to put the support in place? Are they even aware of a heart condition? Lack of collaboration. So those plans that we're talking about, the EHCPs and the HCPs, that's a document that's been created or being implemented in a way that's filled with collaboration. It should be written by you, the child, and the school together, so that there's a clear understanding of what needs to be in it. Also collaboration, as we've just discussed, between the hospital teams and the schools. We're not looking for the nurses and the cardiologists to come into schools and tell them exactly what's going on, but that open communication, or even that willingness for a hospital team to give you the documentation you need to pass on to the school at bare minimum. And lack of resources. With the EHCP, there's funding assigned to it. With their healthcare plan, which is what all of our children with single ventricle hearts should legally have, there's not that necessary funding. Also, we hear often that schools are understaffed. We know that sometimes putting that support in place can be difficult, but it still needs to be attempted. There are certain things that I'm working with the Health Conditions in Schools Alliance to try and get across to the Department of Education, and one of them is issues with attendance and the current attendance systems in the UK, where our children and our teenagers almost feel unfairly penalised because of their heart condition, and as a knock-on effect, the parents too. These are barriers to inclusive education that should be overcome, can be overcome, but probably need a little bit of work to get there. So I'm going to talk a little bit as advocacy for your child. This is not me telling you what to do or judging you in how you're advocating for your child. You are all so important in your child's journey in school. I have people or parents come to me worrying that they're not doing enough. You're doing enough. It's a really hard system to face, and you're facing it. You're advocating for your child by just coming to us and having those conversations. By advocating for your child, you're ensuring that these decisions that are being made about their education, the support that's being putting in, and their day-to-day life at school is exactly what they need it to be in order to get to where they want to go. So your advocacy is important. You're not alone, however, in this. We are here to support you. We're on the end of the phone. We can help you come up with resources. We can help you understand the legal documents that you have behind you to kind of push forward that advocacy. Certain things to think about though when we're talking about advocacy for your child, or what advocacy can lead to. It gets support in place earlier. So the sooner you start advocating for your child, the easier it gets for you, because it becomes a learnt behaviour for you. It's almost like practice. But the earlier the schools start to understand, the earlier the support gets put in place. So key moments at the beginning of an education journey, that's where you need to be speaking loudly on behalf of your child, especially at the early moments, because they're too young to do it themselves. And 9 times out of 10, you'll go to an educational provision, a school, a nursery, a play group, where they haven't heard of single ventricle hearts before. So this is a new learning curve for them. That being said, it doesn't end at the beginning. That advocacy is necessary throughout all the steps. You've got huge moments of transition from primary to junior, junior to senior, senior to college. These are key moments, and it doesn't matter how old the child gets, they're going to need you holding their hand a little bit in those moments, because it's scary advocating. Your advocacy shapes what goes into their plans. So as we spoke of before, those healthcare plans and educational healthcare plans are a document filled with collaboration. You're in the room with them, producing or co-producing with the school that document. So it's really important in those moments to speak up. Nothing is silly. Nothing doesn't matter. Whatever you feel or your child feels is going to support them is worth verbalizing. It's not always doable. You might be met with some brick walls, but speaking up is really important. As I mentioned before, advocacy helps your child learn to speak for themselves. As they grow older, the key or the target we have is moving a child or young person into independence. And the main way of learning is through example. So if they see through you that it's okay to speak up for yourself, how to speak up for yourself, and that they are important and they need to speak up, they're more likely to copy and mimic and learn that behavior as they grow up as well. And your advocation protects you and your child. School attendance systems, which are not created with children with physical health conditions in mind. Um, if you're advocating, or I'm going to stop saying advocating, I've been saying that a long time, but if your school is aware of the health condition that your child has, it protects you and your child. If the school knows that you have certain hospital appointments, if the school knows that on the healthcare plan it says that this child needs certain recovery time, have you spoken to your child about, oh, not your child, to the school about less days per week, less hours per week because of their fatigue, because of their energy issues? How does that impact the attendance instead of them just having days off? You know, there's certain things that you can do to protect you and your child from a system that wasn't necessarily built for a child with a single ventricle heart condition. And we spoke about at the beginning accessing the right support tools. Um, I've spoken with countless parents, and it's been set up in a way that it's really hard to understand the difference between certain plans and what the school can do for you, even without those plans in place. So we're going to start with the plan that every single child with a single ventricle heart condition is legally able to have, the support document in which the school should have in place for a child with a single ventricle heart condition, and that's a HCP or an IHCP, an individual healthcare plan. Like I said, this is a legal requirement for all children, teenagers, and young adults. It goes right up into university with a single ventricle heart condition. Again, it's a collaborative document. It can list things like the medications that a child or young person has. It can touch upon activities that they're able to do. Things like contact sports, which might not be a great idea. Their abilities, first and foremost, what are they able to do before we start talking about the restrictions and what they're not able to do? It's also going to be listing the things that they are able to do so that they still are able to access that. We have so many young people that come to the youth activity event that join us, and it's the first event of this kind, of this type, that they've had access to because schools have just blanketed and not understood their abilities, only what they're not able to do. So they've missed out because of that. So in that plan, it also lists what they can do. It also lists things that they should probably sit out of. But again, that's different for every child. It touches upon attendance, and this is something that I would suggest always putting into the healthcare plan. You know, there's going to be scheduled hospital visits, there might be hospital stays, there might be interventions within hospital that the child needs to have, and that's completely out of your control but necessary for that child. So, you know, putting that within the individual healthcare plan or the healthcare plan is something that protects you and your child. Things like what to do in an emergency. Do the staff at the school have a clear plan of what to do if your child needs emergency support? And also a staff training plan. So what are the school doing to ensure that the people that need to know, and the people that don't know everything still have some kind of idea so that they get support wherever they need it. Your reasonable adjustments as well is going to be in this healthcare plan, which can also move forward and help them with exam prep. So reasonable adjustments can include things such as leaving lessons a couple minutes earlier so they have a bit longer to get to the next classroom in secondary school, which means there's less of a rush and their energy being used. It could be the understanding that during winter months it's super, super cold and their circulation isn't as great as someone that's got a healthy heart. So are they allowed to wear a pair of gloves in the classroom? Can they keep their coat on for 10, 15 more minutes before that so that they can acclimatize? Things like fatigue. Do they have access to digital tools to help them with that fatigue? Does their fatigue affect their concentration? If so, are we looking at when in the week certain lessons are? If we're putting PE first lesson on a Friday, we know that all the lessons following that are going to be a bit of a whitewash and they're not going to have the energy or ability to understand. So looking at what their timetable is, all these things can be put in the individual healthcare plan, and all children and young people with a single ventricle heart are legally required to have one of those. The school is legally required to provide that. The other plan is the EHCP, or the Educational Healthcare Plan, and this tends to look at the SEND support. So if your child has any other diagnosed conditions such as autism, ADHD, etc. These plans, they're not a legal requirement for all children with a single ventricle heart condition. These are assigned by the local authority, so you have to apply for it. And usually you need to have another diagnosed condition. It's not just having a single ventricle heart, there's no just about it, but only having a single ventricle heart condition doesn't qualify you to an EHCP. Because these are then approved by local authorities, there's some funding associated to that. And Senko is heavily involved in these EHCPs and usually are a point of contact within them. Might have intervention sessions as part of the EHCP to ensure that the support is in place, that they have longer to understand certain things, and that the well-being of the child and their needs are met. The EHCPs are also really, really helpful for transition supports between schools and years, because we find those with additional learning deficits or development issues can really, really struggle with those transitions and change generally. So your child may well have the need for an EHCP if they've got additional learning deficits, but not all children with single ventricle hearts are. If you do have an EHCP, however, please ensure that all the information that would be on the other plan, such as medication, attendance, reasonable adjustments for the physical side of the condition, is still on the EHCP. That then needs to become a document that covers everything, because you won't have both. I hope this is making sense. There's still Senko support within schools, even if you don't have a plan. I wouldn't suggest going through education without a plan. Like I say, you're absolutely entitled to a healthcare plan. But if you decide not to do that, there are still things that the Senko team and the school can put in place to understand what your child needs. So I want to just pause it there before we move on to the next session, the next part. And don't worry, with the recording, this bit will cut out. But the next part of the talk is going to be about the consultation as such. And it's on the same topic, but it's a slightly different strain. So I just want to take this opportunity to see if there are any questions about what you've just heard, anything you'd like to share, or just needs a safe space to talk about. Please understand that that's what this is. Anything that's been discussed in here, we're going to keep in this room. But do we have any questions about inclusive education, schools understanding, the plans that you are entitled to, the support that school puts into place? Is there any questions or anything anyone would like to share? Oh, so I'm gonna stop the recording and, and then I'm gonna, I was already screen sharing. Um, and then I'm going to, there we go. So we're going to go to here. And we're going to play from the current slide. So as I said earlier, the Department of Education, following the tragic passing of a young boy called Benedict with allergies, the Department of Education decided that their strategy guidance for supporting young children and young people with medical conditions and allergy needed updating, and the response needed to be a little bit better from educational provisions. And I was able to sit with a number of other organisations and the Department of Education on the creation of this document, which is currently in its consultation phase, to make sure that CHD was represented. When I first joined this group, CHD wasn't even on the list of medical conditions, but we're represented on it now quite heavily. I'm going to take us over there and we're going to have a little look at what this is. Yeah. So, by the consultation, this is now up for views, for opinions, for feedback from medical professionals, educational professionals, and you, parents of children with medical conditions in school. It is so important that you advocate, as we've spoken about before, but also give your opinion on this document and the likelihood that it was going to be able to support you, what you think the schools are going to think of it, and whether they will follow it, even though it's statutory guidance. We know that's not always the case. So we're just going to look at this. So if you want to follow in this, have your voice heard on this consultation, you'll know what to do. So all the information about, and I will ensure that you get the link to this, FYI. The all the information on how to be part of this consultation is in that initial link there. This is the actual draft statutory guidance for supporting children and young people, and it has been completely rewritten and completely updated. Because we haven't got long, I'm just going to stick to the parts about CHD because we could go on for forever. But this is, again, the proposed new statutory guidance for schools to support your children. So they have all of the general kind of information that they had before, what they should do for trips, emergency situations, etc. But a big difference in this document is that there is a list of medical conditions and allergies that affect a great deal of children in the UK, and information about that and how it pertains to education itself. So here we have congenital heart disease, and I was able to write about congenital heart disease. Even though I mentioned single ventricle physiology in the description itself, it has to be CHD, not just single ventricles, to include all children with CHD. But when you click on it, we actually get a whopping big section now in this new statutory document. So within this, I've written what symptoms can be manifested with CHD, how this can impact schools, and I've tried to include from the less complex CHD diagnoses to the more complex. And we know as a single ventricle heart, you are one of the most complex CHD diagnoses that there is. And I did include single ventricle heart specifically within this as well. Within this document, I've also written a whole part about what actions could support children and young people with congenital heart disease. So it's written there in the actual statutory guidance itself. So flexibility around attendance and medical appointments is written right here. Regular communication with the staff across the school so people know the impact that it has, no matter what class they're in. Careful planning for meals, hydration and medication. Access to supportive seating, temperature control, adaptive equipment, support for handwriting speed, because that can sometimes be an issue. Note taking or motor challenges. Reasonable adjustments for PE, not a blanket, they can't take part in PE, but reasonable adjustments. Proven rest breaks or access to quiet spaces when fatigued, and then special consideration for exams. So in this new statutory statutory guidance, that's the word, guidance for schools, we have a big section that explains all about CHD, but also actions in which schools can support. And then as a little top off, within the CHD section, there's a link straight to the Little Hearts Matter website and our education resources, which I'm sure you've all accessed before, that really breaks it down. So that is the CHD part of the new proposed statutory guidance. It is a long document. It absolutely is a long document, but it's necessary. So let me go back to, because again, I start talking, I get off onto a tangent, and then I lose myself. So what the Department of Education wants, and I know would be so great for you and your children, is having your voice heard. As a parent of a child with a single ventricle heart, you have the experience, you have met the challenges, you have experience of what the schools struggled with in putting the support for your child into really practical solutions for challenges. So it's a really, really great opportunity for you to impact this consultation, even if your child is older and has been through the process already. You are still a parent of a child with a single ventricle heart or CHD that has gone through the education and can look at it with hindsight and give your opinion. All of your opinions are so vital for the consultation. So this is an invitation. If I will send you an email with the link on to kind of, if you would like to give your opinions on the consultation, and if you think I've got anything wrong, please, add your comments about that as well. But I think that if used correctly, this can really, really help our our children in education. And if the consultation, if it's approved, this new document, this new statutory guidance will be getting pushed into schools from September. And that is the end of my talk. I hope you've got some questions or comments.